The fight against lung cancer in the 20th century. The use of science and technology in diagnosis and treatment, and the role of government. Lung cancer used to be rare, but it has become more common since the 1900s, and it is the second most common cancer today. Every year, 40,000 people are diagnosed with lung cancer. Medicine has proved that cigarette smoking is the major cause of lung cancer. Smoking was very popular during the early 1900s, and rates of smoking increased during the First and Second World Wars. Pleasingly, smoking rates in the developed world are now down. 90% of cases of lung cancer are caused by smoking or passively smoking. Lung cancer is a difficult disease to diagnose, and this means it is only when the cancer has spread that the symptoms develop and show themselves. Only 1 in 3 people live as long as a year after being diagnosed. Only 10% live more than 5 years after being diagnosed. Other cancer types have much better survival rates, where 50% live for at least 10 years after diagnosis. The fight against lung cancer has many different elements, and medical professionals are working to improve prevention, diagnosis and treatment. Governments have launched campaigns to prevent people developing lung cancer. Government advertising campaigns warn people of the dangers of smoking. Cigarette advertising has also been banned, and more recently laws have been passed which means cigarettes have to be sold in plain packaging with large health warnings. Recently, laws have been passed to hide cigarettes in shops and make it more difficult to purchase them. Laws have also been passed to make smoking in public places illegal. Through the NHS, the government has also invested in improving treatments, which are also dependent on developments in science and technology. However, at present there is no national screening programme for lung cancer because the technology does not exist to pick up the signs of lung cancer developing in the body early enough. There have been a number of other treatments for lung cancer during the 20th century. Key developments are detailed in the table below. Surgery, radiotherapy, chemotherapy, immunotherapy. The battle against lung cancer shows how different factors we have studied during this course are now working together to improve medicine. For example, the government, science and technology.